Jejunostomy tube feeding is a method of delivering feeds through jejunal access in the small bowel. It is used when there is a contraindication to the placement of gastrostomy tube. The indications are inability to use the mouth, stomach, or esophagus for feeding due to dysfunction, loss of brain function secondary to head trauma or cerebrovascular accident. There are two types. First is Wetzel jejunostomy. Site of placing is 30 cm from duodedojejunostomy. Second is needle jejunostomy, using catheter of small size. For the first procedure, check the medication card and confirm the patient's feeding solution, as well as the volume, method, and rate prescribed by the physician on the patient's chart. Do a thorough hand washing. First is we need to remove our watch before hand washing. Open the faucet and wet your hands. And apply it with a liquid soap. Rub hands palm to palm. Rub back of each hand with palm of other hand with fingers. Rub each thumb clasp in opposite hand using a rotational movement. Rub tips of fingers in opposite palm in a circular motion. Rub each wrist with opposite hand. And rinse hands with water. Dry thoroughly your hands with a clean and dry towel. And use the towel to off the faucet. Prepare your materials and the feeding formula. Check the formula's expiration date. And make sure that it is suitable temperature for feeding administration. And these are the materials needed for the procedure. Introduce yourself to the patient and build rapport. And confirm the patient's identification through inquiry. Check the patient's armband. And orient the patient about the procedure. Position the patient in a semi-Fowler's or side lying. This will prevent aspiration and facilitate digestion. Take the patient's vital signs and do an abdominal assessment for distension and auscultation of the patient's bowel sounds. The skin and contour of the abdomen are inspected, followed by auscultation. Normal gut sounds are gurgling sounds, usually occurring 5 to 35 minutes, that can be heard with the diaphragm of a stethoscope. Decreased sounds such as no sounds for 1 minute are a sign of decreased gut activity. Absent sounds or no sounds for 5 minutes are an ominous sign. They can be caused by intestinal perforation or obstruction. Percuss all 4 quadrants using proper technique. And observe what sounds you heard and note for the characteristics of the sound. Tympany is usually present in most of the abdomen caused by air in the gut, a higher pitch than the lungs. Begin light palpation by depressing the abdominal wall not greater than 1 cm. At this point, you're mostly looking for areas of tenderness and to identify any occurrence of dumping syndrome. Ensure the patient's comfort and privacy throughout the procedure. Put on your gloves. Make sure the gloves is well fitted and check if there is hole. Make sure that your extension set clamp or standard J-tube clamp is closed while connecting your syringe onto the feeding port. Then fill the tube to about 15 to 30 ml of sterile water. Open the clamp and let the water drain to ensure tube patency. Clamp your tube again once water reaches the end of the barrel. Pour feeding formula into the syringe with appropriate volume as prescribed by the doctor and open the clamp. After instilling the feeding formula, flush the tube with another 15 to 30 ml of sterile water solution to maintain its patency for the next use. Then clamp the J-tube and close the feeding port. Evaluate the patient's response to treatment and document it. And record what are the findings and conditions of the patients based on your assessment.